let's use the example of a cat. My cat's not well, has a laceration. Can I give some pain relief? I've got some for the dog.
So this is probably one of my all-time small pet peeves to say, is that you send our pet owners home with their magical bag of anti-inflammatories and it gets used amongst the pet
The
friends,
crew.
the crew at home. And I would say you need to be very careful with what you are giving to your pets. Any sort of human anti-inflammatories are a no-no. Rather phone in and check, but that is a no-no. There's obviously anti-inflammatories that are specific for dogs and those that are specific for cats.
Welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara, and today I have a really special guest, Dr. Emma Brown. Welcome.
Hi, Cara.
She's from Hillcrest Veterinary Hospital, and I know you're a very busy lady, so thank you so much for joining me.
No, thank you for having me.
It's very exciting. So today our topic of conversation is quite a relevant one. I feel it's something we see every day. Our pet owners are noticing every day potentially or not. And I think that's why we have to have the conversation. And that is about pain in our pets.
Yes.
So I suppose my opening question to you is, why do animals feel pain? What is the purpose of pain?
So pain is often experienced with quite a couple of things, normally due to injury, your pets run in the garden, strained a leg, disease as well, so any sort of illness, they can feel pain with that as well. And also for our elective surgeries that they go through, when we send them in for neuters and spays, they are going to feel some type of pain after those procedures as well. And yeah, it's one of those things that is part of life that our pet is going to definitely feel or experience throughout their life or at some point in their life. And we need to be able to identify it and help them with that.
Absolutely. So would you go as far as saying that pain has a purpose? Would you say that it's there as a protective mechanism, for example, or that there are times that actually it is good to experience pain, or is pain something that we always need to try and mitigate?
So I'd say we always need to try and treat pain. We always need to make sure that we are addressing it. It is part of one of the 5 freedoms for animal welfare. All pets are required to be pain-free. It also forms part of our 5-point assessment when we're assessing our patients. So obviously when they come in, we're assessing temperature, their pulse rate, their breathing, pain, and as well as nutrition. And I think it forms, make sure that we get a good general exam. And I think it's important because it tells us that there is something wrong with our pet. It is a protective mechanism to signify that there is something going wrong and we need to address it.
Okay. And so there are some terms that I think it would be nice to clear up just for pet owners that we use very freely, but may be a little bit confusing. And I think we take that for granted sometimes. So wanted to start off with the difference between acute and chronic pain. Are you able to help us with that definition?
Yes, so acute pain is normally pain that is experienced at the time of an injury. It lasts maybe a couple of days to a couple of weeks. And, we can treat those quite simply with a few days of either anti-inflammatories. And it's normally just due to an injury. You run in the garden, you strain something, maybe a couple of days, you just need, some downtime. And then our chronic pain is something that we are experiencing for several weeks to months, sometimes even years, and in some cases in our pets, it's going to be lifelong pain that we are addressing. And that is one of the more difficult parts of pain that is more difficult to treat and may have more subtle signs. So chronic pain is something that is definitely very important.
Absolutely. So let's go into some of those signs. So let's start with the acute, the things that maybe, like you say, happen suddenly, maybe easier to recognize, but some of the things that we assess and that owners may recognize if they alerted to some of the typical signs that show that their animals are in pain. Are you able to take us through some?
Yeah, so our acute pain can often, it's normally quite evident. So limping might indicate, sore leg. It might be crying, whimpering, vocalizing, when you pick the pet up. Those are normally signs of sort of acute pain. It's happened right now. then sort of our chronic pain, sometimes signs can be subtle. It's important to realize that whether acute or chronic, these signs are going to vary very differently between pets as people do. We don't always show pain signs in the same way. And some of these signs are going to be very subtle. So as well as the physical changes such as limping, we might also see behavioral changes. So we might notice that our pets have become a little bit more aggressive, not only towards us, but other pets in the household. They might be restless, so battling to settle down at night. Their sleep duration might be shortened. They might not be able to actually get any sleep. You might find that they are licking certain areas of their joints, stomach, also not wanting to exercise, reluctant to go outside, not climbing the stairs as much, not wanting to be with the family. And then we also get our cats.
So let's do the difference. What are the distinctions between the dogs and cats? Do they display them differently? Or?
I think cats, it's definitely a little bit more challenging to assess whether our cats are in pain. Some cats are outdoor cats, so we don't see them at all for, when they come in at night and they eat and then they shoot back outside again. So you might notice that your cat is wanting to spend more time indoors. They might be a little bit more lethargic. Also not eating very much. And I've also noticed with them, they tend to lick areas that are quite painful. They have their general grooming, but they can over-groom certain areas that are a little bit painful. So we really need to try and, get used to our cat's behavior to see when there are changes in that behavioral pattern and try and identify them quite quickly.
So let us use a case example. I had the unfortunate situation this weekend of my new addition not understanding that the dogs were on that side, or maybe understanding and just not realizing the consequences, and being chased by one of the dogs. And I was hoping that she had escaped uninjured, but she was injured. And so one of the first signs that I noticed with her was, well, firstly, she was missing, that she was hiding. So in terms of, cats sometimes hide, especially when you have other cats and it's a new addition, you've got other behavioral reasons why they may be hiding. But one of the first things I noticed when I looked and found her under the bed was that her respiratory rate was up. She was breathing, she was stressed. Obviously she'd just been chased by dogs. Are some of those signs typical signs that owners can spot, or is that something that's more for the vets to be able to, the heart rates, the respiratory rates, the temperatures, are those the kind of parameters that we're expecting pet owners to be able to notice? Or?
So I think definitely breathing rate is something we can definitely, get our pet owners to be more aware of. It's not a difficult area to look at, just behind the ribs on the stomach. You can often see it. Generally, breathing should be a quiet and noticeable activity that your pet is doing. And when that stomach is really blowing up and heaving, that's signifying some type of distress. In cats also, when they get very stressed, they tend to open mouth breathe as well. So it's hugely important for owners to know that any sort of open mouth breathing in cats is a no-no, and that pet needs to be taken to a vet as soon as possible. And like you said, hiding, that for cats is one of the main signs that we do see. We often get pet owners that come in and say, I've just brought my cat in, it's been hiding for 4 days. I'm sure there's something wrong. And yes, for cats that are normally indoor animals that go off and hide, it's definitely a sign that there is something wrong.
So that isolation, a bit like you were saying with the dogs, of separating themselves, not interacting so much with
family, yes.
Okay. And so I suppose I don't want to lose the opportunity to talk about the chronic, not necessarily with cats, but the chronic signs and use a bit of an example or my experience of it. And that is that I'm always surprised, and I understand it, how sometimes people are not aware that their animals, for example, have hip pain, because it's something that progresses quite slowly, and they associate that perhaps with age. And so I'm thinking back to my experience of sitting and watching, I had the benefit of sitting at a coffee shop and watching quite a few people walking their dogs and having a discussion with a friend and saying, oh, that dog's in pain. Oh, that dog's in pain. I was actually quite surprised at how many lovely proactive owners walking their dogs, but at how many dogs were uncomfortable. Now, I know that's something that we look at, even you talking about the clinical examination. One of the first things we do when and you do it, I mean, this is why I'm bringing it up, is you look at your patients in the consult room. You often, in between things, you recognize the owners are there, you greet them, hello.
Yes.
We start looking at that point and assessing things,
so
don't we?
From the time that they are leaving that waiting room, I feel like it's quite an important time to start assessing the dog. The dogs are generally quite reluctant to walk around in the clinical exam room, and it can also be difficult to judge because they become quite nervous. So that is your first opportunity to see how these dogs are getting up, how they are walking to the consult room, and that's generally where I will start my sort of examination of a pet. And like you said, a lot of people don't know that their pets are in pain. They assume that it's just, it's old age. And the question that comes in a lot is, once we've discussed, possible hip arthritis or hip pain, people will say to me, okay, so I've got the medication, but what am I looking for to know that my dog is in pain? How do I know? And I tend to just say, go through what we've discussed with the clinical signs. This is what you need to look out for. How easily do they get up? How are they willing to jump up on the couch? Are they walking up and down the stairs nicely? Are they resting more? And we go through that in our clinical exam. And I feel it's really important to educate owners and equip them with the tools that they are able to assess their pets.
Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we proceed, let's discuss a vital aspect of feline care, catering to senior cats' needs. Allow me to introduce UltraPet's Optimal Balance Senior Cat Food, meticulously crafted to meet the unique needs of aging feline companions. This specialized formula features a balanced blend of nutrients, including 34% protein, 12% fat, and 4% fiber, ensuring your senior cat receives the optimal nutrition as they age. With a delectable chicken and rice flavor, UltraPet ensures that even the most discerning senior cats will enjoy their meals. Plus, the vacuum-coated kibbles deliver a taste experience that will keep your cat coming back for more. What sets the senior cat food apart is its thoughtful formulation. With added taurine to promote good eyesight and healthy cardiac activity, your aging companion can enjoy their golden years with vitality. Made with fresh meat, this food provides a better source of healthy protein, while essential vitamins and minerals from VitaCat supports overall health, body function, and immune system protection. For ongoing dental health, the inclusion of calcium and phosphorus help protect your senior cat's teeth. Plus, the optimal mix of omega-3 and 6 fatty acids support a shiny coat and a healthy skin. UltraPet's Optimal Balance Senior Cat Food is available in 2 kgs and 4 kg packs, providing the perfect solution for senior cats transitioning into their golden years. Give it a try and ensure your senior companion enjoys a healthier and more active life. Your pet will thank you, and you'll appreciate UltraPet's dedication to feline well-being. Now, let's return to our conversation. One of your first statements is we ideally want our pets or our patients to be pain-free.
Yes.
But very rarely do we actually manage that. So that's always the aim, is to try and get it pain-free, but at least to improve quality of life with the treatment regimes that we have available to us, to be able to make them feel more comfortable.
Yes.
I mean, obviously acute things we want to resolve.
Yes.
But the chronic ones, very, very different, aren't they?
Yeah, the chronic ones, I find it's going to be, and I think this is what owners also need to be aware of, is chronic pain. It's a process. It takes time. It's continuous continuous evaluation of the pet, seeing what works, seeing what doesn't work. It's not just, medication. It's what is going on at home. What activities is your pet doing at home? Is it running 5Ks a day? Is it, jumping up on furniture? Are we on the right food? Are we, receiving the right weight management? It's a whole range of things that will contribute to relieving pain in these chronic patients. And I think educating our pet parents about that is really, really important.
So let's go through some of the things that owners can do. I mean, we know what we can do as veterinarians, but what are the sort of things that you do take owners through? Take us through an example. I've got a quite a elderly Labrador. He's a little bit overweight, as they often are, and I've just been noticing that getting up and down is more difficult. What is the sort of advice, if I come and see you, that you're going to advise sort of as a starting point?
So normally as a starting point, as I said, we get the pets in from the waiting room. We're assessing how they walk. We'll have a chat with the owners about how long they've been noticing these clinical signs, what clinical signs they've been noticing. Also get, a general thorough history. I know it often takes time and it's one of these tedious things, but it's so important to know what these dogs are doing on their daily routine, what food they are eating, what things owners have in place for their pets at that time. Then they'll obviously have, a good thorough clinical exam where we flex all the joints and bend all the legs and do all these funny things. We may suggest doing some x-rays if we pinpoint a certain area that is sore. I think it's an x-ray is a really good starting point to see where we are in the disease process. Do we have really bad arthritis on our x-rays? Is there really nothing there? And it forms a baseline for a monitoring point, so that if it starts to get worse at any point, we can then re-x-ray and say, oh, actually this is looking bad, we need to maybe do something else. And then I go into speaking about how we're going to manage our pets, because the first off point is to tell them that this is going to be a lifelong management. This is not a short-term fix. It is something that we have to work with them in the long term, and it could be their entire life that they are going to be working with this. So it's normally three things. So our pain relief, which is what we can offer as vets with medication. There are a range of medications that we can do dependent on the pet. So depending on your severity, you might start off with, just one non-steroidal or an anti-inflammatory. If more severe, we can add on, extra medication to help with comfort. If tablets are not for you for everyday dosing, there are once monthly injections or weekly injections that can be given as well. So we discuss which treatment plan in terms of providing pain relief would be best for the owner to give us the best compliance. Then we talk about exercise. So obviously exercise is hugely important because we want to keep those joints moving, those muscles going. Although people think that, we've got a sore leg, I don't want to walk on it, we need to still keep the movement going to make sure that they, are going to be comfortable. And obviously it helps with the weight. So weight, a lot of people say, my dog's overweight, but, that's not contributing to pain. And it does. It puts a lot of pressure on our joints. It affects our weight distribution. So compensating limbs are then going to become sore. So that is something that I chat to them about. And I really encourage owners to communicate with us about, okay, no, that's too expensive, so let's try something else with food-wise. And every time they come back, it's just a conversation of how's your exercise going? How's mobility going? How's the feeding going? Do you think the pet's lost weight? Have we had snackcidents? Things like that. And it's a lot of communication with owners. So those would be what we generally would do.
With.
Yeah.
So, and how frequently would you want to be seeing these patients?
I think it's a little bit long. So normally for our patients on chronic meds, they're only required to be seen every 6 months for a script renewal. And I believe a lot can happen in 6 months. You can gain or lose a lot of weight in 6 months. You can become, quite sore over the 6 months. I feel like, at least every 3 months, these pets should be seen. I quite like our pets that are on monthly injections. We get to see them every month. We get to see that improvement of them getting up in the waiting area, walking into the consult room. We are communicating with our owners more. We're building trust. I think I prefer the monthly sort of visits from these chronic patients. But understandably, there are people that, can only afford to do it every 6 months, and that's also fine. Every 3 to 6 months.
I think one of my biggest concerns with the 6 month period, just like you, is that, like you say, so much can change in that period of time,
Yes.
including things like their body weight. And this is where I want to start the conversation, perhaps, for what may be a little bit of a controversial question. But one of the things that I've found in my career is owners getting very upset when we do not give things over the counter. You knew where I was going.
Yes.
Could you perhaps give some clarity as to why we do not dispense these sort of meds without pets in sort of under our care or without? So I slightly primed you there with the whole weight thing, but obviously we get that a lot. We have receptionists call us over and people saying, can they have some pain relief for their pet? Why is it important that we see them?
This is something I think I encounter on a daily basis, where a pet owner will phone in and, great, they've identified their animal is in pain, and then they say, can I just have a couple of tablets just to tide him over for 4 days? And if he's not better, I will bring him in. And I think this comes from, with us, we feel an ache or a pain. We head off to the pharmacy. We tell the pharmacist, my head's sore, my stomach's sore. And there you go. You handed your pain medication. So why can this not be done for pets? So there aren't any over-the-counter medications that are licensed to be used in pets without a prescription. And I think this comes from, like we said, with our clinical signs earlier, our signs of pain in our pets, because they're not able to communicate with us where exactly the pain is quite non-specific. So, for instance, we might have our dog that's limping. Sure, that could indicate a sore leg. However, we spoke about reluctance to exercise. So, being reluctant to exercise could by all means indicate that your dog has a musculoskeletal problem, so sore muscle, joint, anything like that. However, it is also an important clinical sign in our cardiac patients, so our heart patients, that might be deteriorating. And actually, our anti-inflammatory drugs are not indicated or are contraindicated for our cardiac patients. So that's really important that we know the difference. Secondly, we spoke about cats that might become quite aggressive. That may indicate pain, but our cats who suffer from endocrine disease, such as our hyperthyroid cats, so an overactive thyroid, also become increasingly aggressive. That's something that we need to be able to see. And then as well as restlessness and panting, we may just think they're stressed, they've been chased by something. But in actual fact, a lot of the cases that we see for either gastrointestinal signs, so our sore stomach, an upset stomach, or even liver disease or kidney disease, and pancreas as well, they can present like that as well. And to be able to pinpoint those areas is important, because prescribing an anti-inflammatory for a dog that has a gut problem is going to make the problem a lot worse. So that is why I do still believe that all our anti-inflammatories should be vet prescribed only. It gives us our prescribing rules tell us that we need to be able to take a weight on the animal. So we are not overdosing. We're also using our minimum effective dose, which is really important because that gives us room to up the dosage if we need to. We are also making sure we've conducted a full clinical exam from head to toe to pick up on any sort of underlying conditions and minimize the side effects, and also educate our owners on the side effects of using these drugs.
Very important. And that's a great way for us to go into. We need to talk about the areas and the ways in which we can manage pain. But as we're on the subject of anti-inflammatories, what are some of the side effects that owners may notice if there's a problem?
So whenever I prescribe our anti-inflammatories, I also always have a sit down with the owners, and I say that they should be taken with food. That is something because of the risk of causing stomach ulcers. It can also cause vomiting and a bloody stool. So we often say as soon as vomiting or diarrhea starts, you have to stop the medication straight away and bring the pet back to us. Another one is interactions with other drugs. So it is hugely important when you bring your pet in to let us know if your pet is on any other medication, because these drugs can interact. Our main one is our steroids. So say your dog is on medication for itchy skin, and a short course of steroids has been prescribed, you need at least a 7-day washout period. So that means a period where there are no anti-inflammatories given while they finish the steroids. And that is because giving anti-inflammatories and steroids causes huge ulcers within our gastrointestinal tract. And these can have really severe consequences for our pets.
Yeah. Absolutely. And so vomiting and diarrhea, the main things, and obviously maybe impotence that point before.
Yes.
Salivation and whatnot. So we spoke a little bit about anti-inflammatories, and I think the name is quite nice because it tells you what it does as well as pain relief. So it works at the site. Can you help break down perhaps some of the points or areas that these pain killers target in order to manage pain in our pets? Because obviously we have various classes of pain relief that we can use, the first line treatment that we start with, but things perhaps that we either add on or as it progresses, we have the opportunity to tag on to our treatment regimes.
So without getting too complicated,
I'll keep it simple for me,
keep it
please.
simple. So our anti-inflammatories, they target certain receptors in our periphery, and they prevent certain substances being made so that these signals are not transferred up to the brain where we perceive pain. Then obviously there are a multitude of receptors that these anti-inflammatories work on, but our main ones that our non-steroidals work on, so our normal anti-inflammatories, are called COX-2, and they can there's 2 of them, so they can be quite selective, and the problem with these, like we said, with our side effect is that some of these receptors are also found in other organs other than just our joints. So for instance, our COX receptors are also found in our kidneys, which is why these drugs are contraindicated for anyone with kidney problems or dehydrated patients. So this is quite an important one, and this is also why they bring about such negative side effects. We have a really nice once-a-month injection as well that targets a different receptor, and this is called a nerve growth factor inhibitor. And not only do they prevent the pain getting up to the brain, but they also modulate the environment within the joint. So once you have pain, you tend to get more amplifying signals because that pain keeps going and going and going, and you get a term called central sensitization, which is just an over-amplification of these pain signals. And these nerve growth factor inhibitors have actually found to prevent the amplification of these signals, which we find works really nicely. And then, obviously we also have things like our joint supplements that can help. And those are just helping with improving the environment within the joint. So providing things that are already there, but just giving them a little bit more.
Giving them what they need for a repair.
Yes, for repair. And then, also our diets as well. Some of our prescription diets also contain these the glycosamines and omega-3s, and that is also just to help the joint environment. So those would be some of the pain remedies that are out there.
And then we obviously use some for our inpatients that we do not generally prescribe.
Yes.
And these are ones that are sometimes either provided via a patch or intravenously.
Yes.
Other than obviously some of the sedative properties of these, why is it that it's a risk to give to to owners to administer?
So these are also on our higher scheduled medications. So obviously each drug has a different schedule, and they have different prescribing requirements. And these ones that we use in hospital normally are our opioids, such as and also things like ketamine as well. And this is because these drugs are, abused within humans, and it's quite a big risk to send someone out the door with, here's your ketamine injections.
Be irresponsible.
It's I would feel very nervous. So they work really well in our hospital patients. I feel that they have minimal sort of side effects. Their side effects are not as great as our non-steroidals, but they definitely have to be used with care and only by people who know what they are doing with them.
And very small doses often.
Yes, very small doses.
And the impact if you do use
and that's
too high.
the scary thing as well, is the small doses is, accidental injection by pet owners is then a huge problem. So that's why into themselves, yes. So that's why we have to make sure that they are kept under wraps and only for us to administer.
No, very, very good advice there. So let's talk about one of the things that we often get is a phone call to say, like you spoke before, you get a phone call and say, my dog's not very well, but I do have some medication over from my dog. Let's use the example of a cat. My cat's not well, or seems to be in pain, has a laceration. Let's keep it simple. Can I give some pain relief? I've got some for the dog.
So this is probably one of my all-time small pet peeves to say, is that you send our pet owners home with their magical bag of anti-inflammatories, and it gets used amongst the pet friends, the crew at home. And I would say you need to be very careful with what you are giving to your pets. Any sort of human anti-inflammatories are a no-no. Rather phone in and check, but that is a no-no. There's obviously anti-inflammatories that are specific for dogs and those that are specific for cats. We actually had a case over the weekend where unfortunately an owner had given their cat Panado, so paracetamol. And not a lot of people know that paracetamol is very toxic to cats. Even in the tiniest doses, they lack the enzyme to convert the paracetamol so that they can excrete it from the body or get rid of it. And it ends up with your cat having to be on a drip and in a hospital and can put them in liver failure. So it's really important, not only from knowing what to give your dogs and cats, but also from a weight point of view. All our dosages are calculated by weight, and a lot of times owners are like, "Oh yeah, I have a 40-kilo Jack Russell. He definitely weighs 40 kilos," and you bring him in and he's 15. Yeah. So it's a big weight variance, and even older versus younger pets. We select our anti-inflammatories based on, this is a younger dog, so chances of kidney or liver problems are smaller, so we can prescribe this one. But older dog, chances of liver and kidney problems, much higher up on the list. We want to stay away from these ones. So I think it's really important to let people know, rather phone in if you are wanting to do that, and you absolutely cannot get the pet to us, but best case scenario is just to bring the pet in so that we can get them on the right dose and the right medication. And
assist with whatever the owner wants in terms of what they can manage with. A lot of people go, I don't want to go because either I'm going to find this really unaffordable, and we do have affordable ways for people to manage their pet's pain. Or they don't want to administer. I find often owners don't want to be the baddie and administer a tablet, for example. Yes. They go, I can't possibly, or they find it really, we may have a dog that's in severe pain and they can't be popping a tablet in their mouth or hiding it in the food. Yes. So there are solutions for those cases where there is either liquid formulation or, like you said, there's injectable or tablet formulations. Yes, and especially for our cat owners, it can be very difficult because trying to tablet a cat,
Yeah, you're taking your life in your own hands.
Especially on your own.
Yes, exactly.
We often have a team with the difficult ones.
As soon as I see the pet owner's eyes go wider and wider as I start to bring out the pills, and I whip out my magical little pill popper, and I'm like, this will help you. But yes, we do have liquid formulations and tablets and injections. So I would really encourage owners that we are there to try and help you come up with a sensible solution. We do want to try and make it easier, but at the same time, sometimes we are also limited by what drugs we have on offer. So.
I also want to take the opportunity before I lose the chance, because I know we're running out of time, to ask, why is it that vets will request blood work for chronic use of anti-inflammatories? What is it that you're gaining from that means there's a justification for it? Because they're pretty expensive.
Yes, so this is also another really lovely question. And when people bring their pets in and they are starting on this chronic medication, I always like to offer a full blood work. This gives us a chance to assess for any underlying problems, assess our liver and our kidney parameters, because so many of our anti-inflammatory drugs are processed by our liver and our kidneys. And if either one is compromised, we are going to have negative effects, and it's going to make the problem worse. So that is the point of the bloods. We also then have a start line or a baseline in the beginning, and then every 6 months we can say, right, this is getting worse. It's affecting our liver and our kidney. We need to try and get onto a different type of medication. So maybe we then move off tablets to an injectable form, or try and find another way of providing pain relief for this pet. And I know the price often deters people from doing it, but it is a really, really important part of managing and making sure our pets are well looked after on chronic medication.
Absolutely. And like you say, a baseline for you to then monitor other things or pick up coexisting issues that may then alter the choice of your treatment regime.
Yes.
But also so that if you see them 6 months later and you go, there's been some weight loss here, not only am I going to adjust the dose, but perhaps we need to determine whether there's been progression of.
Yeah. And again, this just emphasizes, our 6 months checks are so important. You know, owners do get frustrated about having to bring their pets in every 6 months, and I know that it is a bit of a tedious thing, but it's in the best interest of the pets, and it gives you the chance to, communicate with us as to how we're doing, how your pet's doing, and if changes need to be made. So it is very important.
So my final parting question is, what would you say to owners who don't know how to currently recognize that their pets are in pain? What would you say is the starting point for them? Just, I know we spoke about this at the beginning, but just in wrapping up the typical things for them to look out for that may indicate that they need to come and see you.
I think it's just important to know your pet's daily routine. Get to know, you can even keep a little diary. I like our owners to keep diaries. They can say, had a great day today, was running around, ate well, then the next day, it was cold today. He battled to get out of bed, and was sort of more reluctant to walk around for the rest of the day. I think just knowing your pet's normal routine, their normal behaviour, and what they like to do is a really important thing to just make sure that you can spot any changes quite quickly. So that would be.
And when the pain gets too much and we've added in all that we can.
And this is a really difficult conversation that you have to have with owners. And again, I add this in our 6 month check. And my sort of go-to is chatting about quality of life. So we do the little quality of life conversation, and I have 3 main points that I chat to owners about. Is your dog eating? Because that is one of the things that is a basic need for them to do. Are they eating and drinking? Are they able to, do the things they like to do? Are they able to jump on the couch? Are they able to run up the stairs? Are they able to run to the door to see you? And then thirdly, are they interacting with you and other pets in the household? And once you start to have times where, she's hiding in the corner, shame, she can't jump on the couch to sit with us anymore and it's really stressing her out, or she's always loves her food and today she won't even eat chicken. that is the time when we say we've done all we can and we maybe need to think about euthanasia. And it is an incredibly tough decision. But I think we are so fortunate that we are able to end suffering for our pets and that we can allow them to have, a pain-free end to their life, and we can be there with them when this happens, and they get to go with a little bit of, dignity and not have to suffer till the end. And I think that just needs to be at the back of everybody's mind when we are looking at chronic medication. We are going to get to a point where we've done all we can do. And that is something that I do try to, just educate owners with throughout these many months that we are going through them. It's a journey. And in some cases, it can happen quite quickly. It happens overnight. And it can be quite unexpected for owners. So by making sure that they are aware of this, I often find they're better equipped to deal with these things. But yes, the quality of life points are something that I always have a chat to them about. And I think the quality of life is the most important thing that we need to ensure our pets have a good quality of life, because, that's what they're there for. They're there for our enjoyment and, to give them the best that they can possibly have.
Absolutely. And I mean, you've got a great relationship with your clients in that you're there to take the phone call and say, okay, they've had a bad day. Yeah, it's been cold. Perhaps, let's try this, or have you thought about this? But I'm here for you if it's time.
Absolutely. And I always try and make sure that any decision they're making, whether it be, I'm battling to tablet my dog every day, this is, really upsetting me to see him in pain every day. There is no judgment with the decision that you are making. The decision is for you and your pet, and I'm there to support you and guide you through this journey, and provide the support that you need.
You're a wonderful vet. Thank you, Dr. Emma.
No problem.
Thank you so much for taking time out of your very, very busy day.
No, thank you.
It's so appreciated. And
Thank
I'm
you.
hoping that this is going to really improve some lives that perhaps, owners, we know they've got great intentions. And so we just want to help them spot some of these things and manage their pet's pain a bit better. So
Absolutely.
Thank you. Thanks for your time. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behaviour? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.